Hi, I'm Dr. Chad Larson. So today I'm going to give you a research update. We've talked on multiple episodes about a condition called metabolic syndrome, which is a condition that features 5 main clinical signs, and all a person has to have is 3 out of those 5 clinical signs to be diagnosed with metabolic syndrome, which is a condition, I call it the most important condition that nobody knows about. And this condition is a major risk factor for heart disease, diabetes, obesity, certain types of cancer, non-alcoholic fatty liver disease, Alzheimer's, and cognitive issues. It's a really, really important condition, and it's not treated very comprehensively in standard medical care. So it's something that I've been working on clinically, trying to dive into the literature as much as I can and apply what I learned from the literature into clinical practice. And so it was really cool to come across a study that kind of worked the other way around. Something that I've been doing clinically for some time now with people with metabolic syndrome was now finally validated in research. And so what they did is they evaluated people with metabolic syndrome and something called time-restricted eating. This has only been done up to that point in animal studies. The animal studies are called time-restricted feeding, and they've used it in animal studies with some really important benefits, but it hasn't been done in humans. So we've had to extrapolate information and just kind of clinical trial and error and come up with our own protocol, but it's really fascinating to see that see how it really worked out in research and then published in an important journal. This is out of the Salk Institute, and it was published. It's actually not even going to be published until next month, but you can still read the article online in Cell Metabolism, and it's going to be studied. It's going to be published next month. So the Salk Institute is out of UCSD, and they have already studied the effects of time-restricted feeding on animals with all kinds of really amazing metabolic effects, health benefits to the animals. But in this case, they took human subjects that were already diagnosed with metabolic syndrome. So they had at least 3 out of the 5 of those categories, which is high blood pressure, high blood sugar, high triglycerides, low HDL, and a waist circumference above 40 in men. That's 40 inches, 108 centimeters, and above 35 inches or 88 centimeters in women. So if you have any 3 out of the 5 of those criteria, you're considered to have metabolic syndrome. So all the subjects in the study did have metabolic syndrome, and they had a very simple but very impactful study design. All they did is they restricted their eating window. So basically they increased their overnight fast. And we've talked about this concept many times, but this is the first time this has really been done on humans who have metabolic syndrome. They've done time-restricted eating in human studies, but not that we're all diagnosed with metabolic syndrome. So that's what was particularly exciting about this. And so all they did is they increased their overnight fast to 14 hours. That's it. So from the time that they ate to the first meal the next day was 14 hours. So they had a 10-hour eating window. So they call that a 10-hour time-restricted eating window, or TRE. In this TRE, time-restricted eating window, they made no other changes. They made no dietary suggestions. In fact, the time that they can choose from, 7 in the morning to, until, so 7 to 7 would be 12 hours. They did 10, so it was 5. So if they go 7 to 5, or if they went, 6 to 4, or it doesn't matter. They could start and stop that 10-hour period whenever they wanted to. So that wasn't set, but they just had to stay within some kind of defined 10-hour eating window. And they didn't tell them what to eat. They didn't tell them how many calories to eat. They did log all their foods and calories into an app, and that data was collected, but there were no recommendations of anything else. There was no changes to their diet, quantity or quality whatsoever, just the time-restricted eating window. And the results were absolutely amazing. With just that particular intervention of a time-restricted eating window over a 12-week study intervention period, they had significant changes in pretty much all of the factors that are related to metabolic syndrome. They had a decrease in blood pressure. They had a decrease in cholesterol. They had a decrease in specifically LDL cholesterol. And they had really significant improvements in not only their body mass index, which means their body weight went down, but more importantly, as far as I'm concerned, is their body fat went down. And then even more important in that regard, their visceral adipose tissue, that belly fat, went down. We know it's that variety of fat in the body that is a much more significant risk factor for heart disease and some of these chronic inflammatory conditions that people have. So that visceral body fat going down is really the gatekeeper probably of all those other effects that happen, like blood pressure and cholesterol and so forth. So it was very fascinating. Everybody in the study had some kind of change to their metabolic picture, and that's a very short period of time. That's 12 weeks, 3 months. That's very, very doable. So it was great validation for something that we've been doing. In some cases, with some patients, I've been more aggressive with that, and we'll go 14 to 16 hours, meaning they go as low as an 8-hour eating window. And I've heard lots of feedback from patients that it's not that big of a deal. In some cases, I'll have people do maybe once a week, twice a week at the most, a 24-hour fasting period. This is for more significant, maybe they're pre-diabetic, something more significant even than metabolic syndrome. Although some severe cases of metabolic syndrome, we've been a little bit more aggressive with the intermittent fasting. But this time-restricted eating window is very doable. They discussed adverse effects that were reported by the subjects, and there were 0 adverse effects. So it's very encouraging, very interesting information, and is a really well-done study and published in a high-quality journal out of an institute that has a lot of respect. So it's something that I'm really grateful to get the confirmation and feedback from the science. And so it's something that we'll continue to double down on in our clinical practice with this really, really important condition. So if it's something that you consider, I think when you make these kind of changes, you should really see a qualified practitioner to help monitor you. There should be some lab work and some clinical evaluation that's done prior and then during and then after, so that you can really make sure that the proper changes and treatments are being applied. So hopefully that's helpful. You learned something. I'll keep reading the studies and bringing you the information. Until then, keep it real.